When you start taking mycophenolate, you start by taking it once daily. This dose is then usually increased to 2 doses a day. You should take this medication with food and water, as this can reduce stomach pains and nausea, and you must swallow it whole. Mycophenolate does not work straight away, and it may be 4 months before you notice any benefit. Mycophenolate can cause side effects. The most common ones are feeling sick, diarrhea, vomiting and stomach pains. If you have any of these side effects or other new symptoms, please let us know by contacting the Nurse Advice line. This includes unexplained bruising or bleeding, a fever, a constant cough or breathing problems, sudden weight loss, unexplained mood changes and the sensation that your heart is beating unusually. Although uncommon, there is a slightly increased risk of certain types of cancer, including skin cancer, whilst taking mycophenolate. Use sunscreen and regularly check your skin for changes to your moles or freckles or any new spots, and if you have any concerns, speak to your GP. Very rarely, people can develop a serious condition known as PML, which can damage the brain and spinal cord. Please seek immediate medical advice if you have difficulty moving your face, arms and legs, speech problems, weakness, shaky movements or unsteadiness, sight loss, changes in mood or behaviour, or pins and needles. You should have regular blood tests whilst you are taking mycophenolate. If you don't, your treatment will be stopped. You'll need to have a blood test every 2 weeks for the first 6 weeks on treatment, followed by blood tests every month for 3 months. You will then move on to blood tests every 3 months on an ongoing basis. You may be more likely to develop some infections whilst taking mycophenolate. If you have any symptoms of an infection other than a mild cough or cold, tell your GP. You would usually stop mycophenolate until you are infection-free. Please stay away from anyone with active chickenpox or shingles. If you have chickenpox or shingles, contact your GP as soon as possible for treatment. You will need to stay off mycophenolate until your spots have dried and dropped off. Lastly, you should have your flu, COVID and pneumovax vaccinations. However, you should not have live vaccines, which includes some travel vaccinations. If you are ever unsure if you can receive a vaccination, please get in touch. Mycophenolate needs to be taken as directed. It is important to take care with it and follow some basic safety advice. Mycophenolate and alcohol can both affect your liver, so if you drink alcohol, please keep within the recommended guidelines, drinking less than 14 units per week. You should not conceive if you are taking mycophenolate. This is because it affects how baby develops in the womb, so always use reliable contraception. If you want to conceive, talk to your doctor or nurse for advice, and don't take mycophenolate if you are breastfeeding. You should also check with your doctor, nurse or pharmacist before you take any other medications, including those you buy in a chemist or supermarket. You can keep taking your usual painkillers if required, including anti-inflammatory painkillers such as ibuprofen, unless your doctor tells you otherwise.